Hi, I'm Dr. Scott Ganz from Fort Lee, New Jersey. I'm very excited to inform you about an article that will be appearing in the September issue of Dentistry Today with my wonderful colleague, friend, fabulous clinician, and co-director of Advanced Implant Education, Dr. Isaac Towell, on full arch implant surgical and restorative considerations. We feel it's very important to be able to diagnose properly every one of our patients that comes through our doors requiring dental implants. And it becomes of paramount importance to be able to assess this patient's anatomy in relationship to the restorative outcome, trying to achieve true restoratively driven implant dentistry. In order to be able to do that, we have to have a solid foundation of diagnosis and treatment planning, which we present in this article showing a full arch dentate patient with hopeless teeth where all of the teeth are extracted. We will do a bone reduction utilizing bone reduction template, utilizing a guided smile chrome design for the full template guidance, and then provide an accurate osteotomy preparation for each of the implants. Now, that alone is important in terms of our planning. But of course, as I mentioned earlier, we want to be able to achieve full template guidance with restoratively driven planning. We can then link the restorative outcome to the surgical plan. And that's what we did for this particular patient, and that's what we're presenting in this article on full arch implant surgical and restorative considerations, utilizing a full template guidance, utilizing a metal guide that allows us not only to be able to reduce the bone to our plan, but also to prepare the osteotomies and then to link the restorative outcome, allowing us to be able to provide the patient with teeth the same day. We hope you enjoy this article, and if you have any questions, please contact us with the information that's provided. It's always a pleasure to work with Dentistry Today.